Hello and welcome. Today we're going to discuss a rare and often challenging pediatric cancer, bladder rhabdomyosarcoma. This is a type of sarcoma that affects the muscle tissue of the bladder. While uncommon, understanding this disease is crucial for early detection and improved outcomes. The exact cause of bladder rhabdomyosarcoma, like many cancers, isn't fully understood. However, it's believed to arise from errors during the early development of muscle cells. Genetic factors may play a role, with some individuals possibly having a predisposition due to inherited genetic mutations. Certain genetic syndromes, such as Li-Fraumeni syndrome and neurofibromatosis type 1, have been associated with an increased risk of developing various sarcomas, including rhabdomyosarcoma. It's important to remember that most cases occur sporadically, meaning they are not linked to an inherited condition. Bladder rhabdomyosarcoma begins when immature muscle cells, called rhabdomyoblasts, undergo uncontrolled growth and division. These abnormal cells form a tumor within the bladder wall. As the tumor grows, it can invade surrounding tissues and organs, such as the prostate in males or the uterus and vagina in females. The tumor can also spread or metastasize to distant sites in the body, most commonly the lungs, bones, and bone marrow. The presence of metastasis significantly impacts treatment strategies and prognosis. The location of the tumor within the bladder also affects bladder function and the types of symptoms a patient may experience. Bladder rhabdomyosarcoma is a rare cancer, primarily affecting children and adolescents. It's most commonly diagnosed in children under the age of 5, with a slightly higher incidence in males than in females. Due to its rarity, precise epidemiological data can be challenging to obtain. It is important to note that although it is rare, bladder rhabdomyosarcoma is the most common soft tissue sarcoma of the bladder in children. In adults, rhabdomyosarcoma of the bladder is extremely rare. The signs and symptoms of bladder rhabdomyosarcoma can vary depending on the size and location of the tumor. Common symptoms include hematuria or blood in the urine, difficulty urinating, such as straining or a weak stream, frequent urination, urinary retention, or the inability to empty the bladder, abdominal or pelvic pain, and the presence of a palpable mass in the abdomen. In some cases, the tumor may cause bowel obstruction, leading to constipation and abdominal distension. It's essential to consult a doctor if your child experiences any of these symptoms, especially if they persist or worsen. Diagnosis of bladder rhabdomyosarcoma typically involves a combination of physical examination, imaging studies, and a biopsy. The doctor will perform a physical exam to assess the child's overall health and look for any signs of a tumor. Imaging studies such as ultrasound, CT scans, and MRI scans are used to visualize the bladder and surrounding tissues, helping to determine the size, location, and extent of the tumor. A biopsy is essential to confirm the diagnosis. During a biopsy, a small tissue sample is taken from the tumor and examined under a microscope to identify the presence of rhabdomyosarcoma cells. Further tests, such as immunohistochemistry and genetic analysis, may be performed on the biopsy sample to further characterize the tumor and guide treatment decisions. Rhabdomyosarcoma is broadly classified into two main types, embryonal and alveolar. Bladder rhabdomyosarcoma is most commonly the embryonal subtype. Embryonal rhabdomyosarcoma tends to occur in younger children and often has a more favorable prognosis compared to the alveolar subtype. Alveolar rhabdomyosarcoma is less common in the bladder but can occur. It tends to affect older children and adolescents and is associated with specific genetic translocations. Staging is also important, describing the extent of disease spread and guides treatment planning. Different staging systems exist but generally consider tumor size, location, lymph node involvement, and distant metastasis. Treatment for bladder rhabdomyosarcoma typically involves a multimodal approach, combining chemotherapy, surgery, and radiation therapy. Chemotherapy is used to shrink the tumor and kill cancer cells throughout the body. Surgery may be performed to remove as much of the tumor as possible, while preserving bladder function. The extent of surgery depends on the size and location of the tumor. Radiation therapy is used to target any remaining cancer cells after surgery. The specific treatment plan is tailored to the individual patient based on the type and stage of the cancer, as well as the child's age and overall health. Clinical trials may also be an option, providing access to new and innovative therapies. Currently, there are no proven strategies to specifically prevent bladder rhabdomyosarcoma. Because the exact cause is not fully understood, preventive measures are difficult to implement. However, avoiding known carcinogens and maintaining a healthy lifestyle may help reduce the overall risk of cancer. If there is a family history of cancer or genetic syndromes associated with an increased risk of sarcomas, genetic counseling and testing may be considered. The prognosis for bladder rhabdomyosarcoma depends on several factors, including the type and stage of the cancer, the child's age, and the response to treatment. With aggressive multimodal therapy, survival rates have improved significantly over the past few decades. Recent research has focused on identifying new genetic targets for therapy and developing more effective and less toxic treatment regimens. Immunotherapy is also being explored as a potential treatment option for rhabdomyosarcoma. Ongoing research is aimed at improving outcomes and reducing long-term side effects for children with bladder rhabdomyosarcoma. Thank you for your attention.